We are back with more Mountain Connections, continuing the important conversation of how we can stay healthy and mentally well during this tough time. Right now, I'm speaking with James Ott. He's a social worker at Red Willow Counseling and Recovery. James, thanks for joining us today.
Thanks for having me, Christine.
So I'm curious, what challenges are you seeing right now within your patient body, within the individuals that you are treating?
Not only are we seeing the typical mental health challenges such as depression, anxiety, and addiction, but we're seeing like these challenges are being exacerbated. Uh, what we're going through right now really brings out a lot of mental health issues and addiction, especially a lot of anxiety because there's just a fear of what if I catch this disease? I could be seriously ill. I could also die. So that's kind of much more elevated than the typical mental health and addiction issues.
And of course, we're being encouraged to stay at home, to be socially distant. This can be very isolating and cause some issues with many people who are struggling with their mental health and addiction.
Very much so. And isolation is the one of the biggest problems or the biggest challenges here because we're social creatures and we really need connection to be mentally healthy. And with addiction especially, there's you know addiction connection has been a form of protection and a coping skill for people with addiction issues, how to cope with that. And when you take that away, a lot of times people revert back to their old coping skills, which is drugs and alcohol.
We're all feeling an increase of stress during this time, and I know it must be especially hard for individuals who struggle with, as we mentioned, mental health issues and with addiction. So, what can we do? How can we support our loved ones or friends who may be really, especially having a hard time?
Well, so I had a friend that him and his wife, I should say, I had a couple of friends, this couple, and they lost a child when they were young. The child was just an infant, and one thing that he told me when he went back to work is, he called me up one day and he was like, "It's just so weird that nobody says anything about this. They come in, they talk to me, they pretend it didn't happen, or they just don't say anything." And he said, "I would just love it if someone just came in and said, 'I don't even know what to say, but I'm here for you.'" A lot of times, we're trained in CPR, we're trained on what to do if someone's bleeding, but we're not really trained on what to do if someone's depressed or someone has an addiction problem. And so, really, just being there, listening, saying something about it. I see you're having a hard time. Are you struggling with a relapse or with cravings? What can I do? Listen without judgment and listen without giving advice. That just really goes a long way.
It can be that elephant in the room that individuals are afraid to address. So, how do we approach the subject? You mentioned it's good to talk about it, to mention it. You might think, oh, they don't want it to be discussed. I don't want to remind them of these hard times, but call it out. That really helps. Is that what you're suggesting?
Yeah, if I saw you and you were like having symptoms of a heart attack, I wouldn't just turn the other way. I would say, "Gosh, it looks like you're struggling. What can I do?" So if we see somebody that appears depressed or anxious, they're not engaging socially with us, as much as possible. They're not calling to us, whether we're in the house with them or they might live in a different household. We might see something happening and just ask them about it. Are you struggling? What can I do to help? I'm seeing you not return my calls or my text messages. I'm seeing you not engage in what you were doing a week ago, and I'm really concerned. What can I do to help?
So, that reaching out can really go a very long way. What about teletherapy? As a social worker, are you really able to connect with your patients? Are they having a hard time with this new way that we have to do everything virtually?
Yeah, that's interesting because my practice, we've shifted to do teletherapy. About 95% of all sessions now are teletherapy. And a lot of people initially were very resistant to it. They're thinking, "Oh, I'm not going to be able to connect with my therapist. I'm not going to feel heard. But we've been doing teletherapy for years. There's been a lot of studies on this, and it really does work. It really is effective, and the feedback we get from our clients is that that they really appreciate doing the teletherapy, and that it is effective.
And before I let you go, you mentioned how difficult this time can be for people with addiction. We've talked a little bit about how we can support. What if you're the individual and you're really having a hard time coping and really struggling with wanting to turn to these addictive substances?
Well, that's all the more reason to, number one, access the coping skills that you do have, and really, number two, really reach out for support. There's a lot of online meetings, and those are hard to attend to. A lot of people don't feel heard or don't feel like they can participate. But really connecting with a sponsor or some sort of recovery mentor. I have several clients that they go to the park, or they'll meet in a socially appropriate distance. That they'll be in a big circle 6 feet apart, and they'll have their own AA meeting or type of support. So whatever you can to even just reach out and connect. AA is powerful because of the connection and the community that people feel, and we've got to try to continue to do that despite the restrictions we're having.
Well, thank you so much, James, for joining us this morning. Really important things to remember and some great advice to help us during this very isolating time. We'll be back with more right after this quick break.